So today I'm fortunate enough to be joined by two experts in the field, Dr. Mark Anderson and environmental engineer Elin Batanzo. Dr. Anderson is a pediatrician in the Denver Community Health Services Department here in Denver and is joining us today to speak about the risks of lead exposure for children. Dr. Anderson directs the Pediatric Environmental Health Specialty Unit for Federal Region 8 and is an associate professor of pediatrics in the School of Medicine and Public Health at the University of Colorado. And his research and clinical interests include how the environment affects children's health, bridging medical disparities and environmental injustices, and taking healthcare out of the office to children directly. Thanks so much for joining us today, Dr. Anderson.
Thank you, Alex. Let me share my screen here. So I appreciate the opportunity to meet with you today. Thank you for your interest. This, I agree, is an important topic, so I'm happy to speak to it today. This is a vignette from a book called Toxic Truth, and it speaks to what lead intoxication for kids looked like a long time ago in the 1950s in the US. It's based on a real story. Fortunately, this doesn't happen nearly as much anymore, but it's a very concerning story. And the author, Lydia Denworth, writes a lot of science articles. She writes in Scientific American, and she has these, she writes books too. And this Toxic Truth was a good, fun read, and it's all about lead. So I'm a pediatrician. I work at Denver Health, and I also am privileged to be part of a national network called the PACES. Here's my disclaimer. And beyond the fact that the source funding for this program is the EPA and the CDC, I don't have any financial disclosures today. So here's what I'd like to quickly go through in just a few minutes. Three champions are displayed on the right. I'll introduce them as we go through the talk. But talk a little bit about what lead does to kids, go through past public health interventions, including some related to water, and the effect that had on blood lead levels in kids. Go through the screening recommendations for kids around lead, and to understand some of the basic epidemiology of lead exposure in our area, and I'll show you some local data as well. But to begin with, let's tackle something that's a little complicated. So these are blood tests on kids. They're expressed as micrograms per deciliter. So what exactly does that mean? Just so we all understand. So with apologies to Matt Groenig, we see deciliters expressed as bottles for each size of baby up to an adult.
Oh, Dr. Anderson,
so one of those bottles is 500 cc's, half a liter, also 5 deciliters. So 6 to 10 month old, you would expect would have about 5 deciliters of blood circulating in the body. Upper left, you see a sugar packet.
Hey, Dr. Anderson, I hate to interrupt you, but we're still looking at the first slide of your screen, of your presentation.
Oh gosh, sorry about that.
No problem. Just wanted to make sure the visual was keeping up.
Well, I don't know what's going on then. Are you still looking at the first slide?
Yes, we still are. I don't know if it's possible to maybe select it along the left-hand side.
Is that better there?
Nope, it's still showing that big first one, although it looks like along the left-hand side of your screen, we can see small versions of the slides, so you might be able to.
You might be sharing not the slideshow version. You might be advancing on a different screen if you have more than one screen open.
Oh
right
gosh,
now.
Let me try to share again in here. Let's see here. Sorry about that. Is that any better there?
Let's see. You stopped sharing your screen, so you could try just resharing again.
Okay. 3 years of this in the pandemic, you'd think it'd be easier to do these things.
Yeah, I think everyone's pretty familiar with rolling with these punches.
Okay, so here is, I'll share again. So
there we go. We see a sugar packet in The Simpsons.
Okay, is that still there?
Yep.
Okay. So again, size of body makes a difference. So the baby on the left has a little bit less blood than the adult does on the right. And then look at the sugar packet up top. That's 2.8 grams. So we're talking about micrograms per deciliter. So doing a little bit of math, about 1/100th of this sugar packet would get you to a level of 5.6 micrograms per deciliter if this was lead. And then off on the right, you see paint chips. Lead paint is not sold in the US anymore, but it still exists in many of our homes. So you can imagine it doesn't take much lead containing paint chips that a kid eats to actually drive a level up pretty high. And along the bottom, I have some examples of cases that I've dealt with. So on the left, we see a bathtub, and lead glazing was used quite a bit in bathtubs. And I can think of one kid who would take a bath in a bathtub and would drink a lot of the water that was in this lead glazed bathtub, and that would drive his level up high enough to where you can actually detect elevated levels in his blood. All right. And now I'm not advancing. Oh gosh. I'm so sorry about this. Let me try one more time. It might be easier if I just do this. Let's see here. Okay, are you looking at the screen with Simpsons again? Yes, I see a nod. Okay.
Yep.
So I'm just going to do this. And oh, wow. So we've gone on to another slide that says lead effects, why worry? So
Yep.
sorry for all the vernacular here, but if you see this this bracelet in the middle, this was sold as a free gift with a pair of Reeboks. And it was a kid, I believe, from Minnesota who got a hold of this bracelet and was chewing on it like a chew toy. And that kid had very elevated lead levels. It was found by doing a blood test on this kid, and it was not known that this bracelet actually had lead until this particular kid showed up. So that's the public health aspect of this. Stuff comes into the country, it gets sold, and it may or may not contain lead until you see a kid who has an elevated lead level. And on the right, I've expressed some of the things you might see in people as their lead levels go up. And it's not until you get very high levels that you begin to see stuff that physically looks abnormal, like high blood pressure or acting abnormal, like the kid in the vignette that was in my first slide. First champion, Herb Needleman. I can't do him justice quickly, but one of the pioneers of lead research in kids. And over his clinical lifetime, he actually witnessed almost an 80% decrease in the average lead level in kids. So very active clinician. He suffered professionally because of the lead paint industry attacking him for things that he was saying. Turns out he was spot on and was exactly right, and we owe a lot to him. Here's some of the public health interventions that have occurred over the years in the US. Lead as an issue is not new. In Europe, there was activity in the 1800s to help abate lead exposure. The US lagged quite far behind. But here in 1978, we see a ban on residential paint. The blue bars show what blood lead levels were in kids on average at that time. So as you follow this graph off to the right, which gets us over to 2008, we see that in 1986, there's a ban on lead in plumbing. So even though the substance is banned, you might imagine that it still exists in the infrastructure that water is flowing through. But the average blood lead level has decreased markedly over these years to where it's really a small portion of what it was back in the 1970s. So we're now in an era where we focus on low lead levels, and this is from an era when the action level, the level that was considered abnormal for lead, was something around 10 micrograms per deciliter. And I already shared that you can't look at a kid and know that they have a level that's 10 without doing a blood test on them. One of the early researchers in the second champion, Bruce Lanphier, he pioneered the idea that low lead levels actually have an effect on how kids do. In this case, it's on intellect. And he was one of the first to be able to represent that as you drive up blood lead levels, even at low levels, that you can see decreases in IQ. So for example, a 1 point increase in blood lead, 1 microgram per deciliter, is correlated with a 1 point decrease in mean reading scores. So 10 points increase would be a 10-point decrease in reading IQ. So these do get significant at higher levels. There were some criticisms of his report, so he did it a little bit differently. He studied it going forward in time or prospectively. He was able to show the same sorts of findings. So increasing a child from 1 microgram to 10 micrograms on average decreased their IQ by 7.4, which is significant for kids. If you want to hear more about Bruce Lanphier and his current activities, this Little Things Matter, it's a wonderful short video to watch that speaks to his current work, focused mostly on environmental justice and the effects lead has on kids who are poor. So some local data. So Denver Health, where I work, we can ask of our system what lead screening looks like. We're a pretty good screener for lead. We screen at 1 and 2 years of age, using 5 as the level at which we would call high. In this data set, which is over 4 years from 2016 to 2019, we had 340, or about 2.5% of our kids that score 5 and above. We're lucky in Denver, where we have a good partnership with the city. Denver Environmental Public Health can go out to homes and actually do an assessment to see if they can't find the source of the lead for the kids that we're checking. Here's some of their data. I have the graph up top that says then. So this is about 20-year-old data, and it speaks to what they identified as the source of elevated lead levels in the kids whose home they had gone to. And we see paint deteriorating, repairing or remodeling soya or pica soil. Pica is abnormal eating, so kids eat things that aren't nutritious. That's called pica. But those 4 left, you can see, explain the vast majority of these cases. We don't really see water appear here necessarily. So those left 4 all mean paint. So paint is the original source of those. And then now, so this is data from about 4 or 5 years ago. We see this large purple bar on the left, outside sources. So this is mostly our refugee population in Denver. So they're coming into the United States. They're being seen at some sort of a healthcare facility. They bring the lead in their bodies, having been contaminated from other parts of the world where they came from. So now modern champion, this gets to lead and water. So this is Mona Hana Atisha. She's a pediatrician in the upper Midwest. She was noticing some years ago in her kids that she seemed to be seeing a little bit higher lead levels than she was used to. And so she did a little research and she published the study that I note there. And this was the beginning of what is called the Flint lead water crisis. So here's a map of Michigan. Note where the Flint River is, and then the city of Flint right there, and then Detroit, lower right part of Michigan, and then Lake Huron. So Flint is a city, is post-industrial. It's devastated economically. It was actually a ward of the state budgetarily. They were looking for ways to save money. One of the ways they found to save money was to use a more local water source, which was from the Flint River, instead of from Detroit water, where it had been previously. Flint's an old city. It's water going through old infrastructure. And the Flint River water is a little different than the Detroit water in that it's a little more acidic, and it tends to pull lead out of pipes and solder more so than the Detroit water. And this was the source of the Flint water crisis, where kids were exposed to and contaminated by lead at numbers beyond what they should have been. Purely an economic decision. And this is Dr. Hanatisha's publication, Pay Attention to the Red Box. So there were kids already living in an environment where the lead levels in water were a little bit higher, but you see that their levels in their blood more than doubled as a result of this crisis. So 10.6 on average, anyone today would consider that an elevated blood level, and we would try to do something about it. Some local data, and this is from Denver Water. So on the lower right, I show the Denver Water's catchment area. Above that, we see a heat map. So the blue and darker blue is where there's increased density of homes that may have older lead service pipes. Denver Water, as you may know, is actively engaged in a program to replace these service pipes. But because there are places where There's older infrastructure and lead-containing service pipes. They've conditioned the water in a way such that it won't leach as much lead out. So they're applying a service-wide intervention to target these few homes. And it's actually 72,000 at last count. And this graph is from a couple of years ago. But you can see by zip code the numbers of these potential lead service pipes. You can go to denverwater.org and put in your address and see if your home has an older service pipe. Kudos to Ann Schimke, who wrote about this recently in the legislation that we're discussing here today. So in thinking about schools testing their water, one, has the water been tested at all? And what barriers it really exist to remediation? And the schools, I think, they're risk averse in terms of cost that might be encumbered as a result of knowing that elevated lead levels exist. This is our most vulnerable population. This is kids. So they're going to be exposed for a lifetime after this exposure. The best thing to do is to avoid the exposure together. And then I asked sort of, parenthetically, what would parents want for their kids? And I think they would want water that doesn't have any lead in it. And that is my last slide. Sorry about the technical issues.
No problem at all. Thanks so much for that presentation. That was really informative and really value the data for Denver and Colorado as well. That's really interesting.